Good morning, everybody. Dr. Anita here from Mylon Family Chiropractic Center. You're riding in the car with the Chiro. So today's topic is going to be on spinal stenosis. So there's lots of commercials out there regarding spinal stenosis and the medical procedures that can be done for that, the main one being surgical intervention. So I had a person come in this week with spinal stenosis, which is, let's talk about what it is first, and then we'll talk about how it can be managed. So spinal stenosis is where the hole that the spinal cord goes through is actually smaller than it should be. So that typically happens as a result of degenerative arthritis. We very rarely, I don't recall ever seeing, quite honestly, in my 28 plus year practice of somebody very young having spinal stenosis. It's usually people over 35, 40 years old or older. And so what happens is, as a result of your spine not being in proper alignment, subluxation, what happens is the bones start rubbing on each other. And when the bones start rubbing on each other, the body, as a way of protecting itself, builds up extra calcium in that area for protection. Well, unfortunately, when that happens, you get these calcium spurs building up on the outside of the bone as well as on the inside of the bone where the spinal cord is. So it's making that spinal cord hole smaller, or the intervertebral foramen, which is the outside holes where the nerves come out on both sides, that becomes smaller as well. And those are the holes the nerves come out from the spinal cord to go to your parts of your body. Example, nerves in the lower neck area are going to go down your shoulder into your arm and hands. Nerves in your lower back area are going to go down your buttocks into your legs and feet. So people will come in with stenosis symptoms of numbness and tingling in their arms, hands, fingertips, numbness, tingling, pain going down the buttocks into the legs and into the feet, into the toes. So this particular patient came in and was having severe numbness and tingling into their arms, hands, and fingertips. And his job requires him to work with electrical and contracting type of work, and he's having difficulty picking things up because he can't feel his fingertips. The other issue is the fact that when he goes to sleep, because he's exhausted after doing a physical job every day, when he falls asleep, that's not a problem getting to sleep. It's the fact that that numbness and tingling going down into his arms and hands and fingertips literally wakes him up to the point where he has to get up and shake the numbness out of his arms and hands. So he went to his primary doctor, who sent him to an orthopedist, who went and sent him to an imaging center to get an MRI. And in the MRI, they discovered that he had this stenosis. And the only option that the medical profession is one of two options. One, drug therapy, whether it's injections, which can decrease some of the inflammation. It will give you temporary relief. Or oral painkillers, narcotics, because he's tried all the over-the-counter stuff and none of that actually works. So narcotics, which are hard to find, thank goodness we've stopped the overuse of narcotic use. Or the worst case scenario is surgery of his cervical spine in his neck, which surgery is definitely not an option unless it's the last resort, because if he gets surgery, number one, he's out of work for I don't know how long, right? And what if they screw him up worse, where he has chronic numbness and tingling into his arm and hands post-surgically, which is something that I see in my office all the time, unfortunately, post-surgically. And you can't go back on that, because once they intervene, you can't fix that. So what is it that I can do as a chiropractor? Well, here's the deal. While I can't fix a small hole because there's arthritis in that hole, What I can do as a chiropractor is make sure that that particular joint and the one above and below it are moving as best that they can so that we stop that degenerative process dead in its tracks so it doesn't progress any further, making that hole smaller and smaller and smaller. Because surgical intervention, it's like roto-rootering that hole. Who wants to do that around your spinal cord? There's a huge risk of infection, paralysis. You can die from surgery, and I'm not making a big deal about it, but it's the truth. And they tell you all this, and you sign all those documents before you go in. And it says in those documents that you could be worse coming out of surgery than when you went in. So why would you ever risk that, right? So the fact that he can shake off that numbness means that he has positional paresthesia, meaning the way he's sleeping, the lack of support in his spine when he's trying to go to sleep is causing those bones to shift further. That hole is already small. When it shifts, it collapses it further. There we go. So what I can do as a chiropractor is make sure that we maintain the mobility of the spinal segments in that region of the spine so that he has proper mobility. He does not have continuous swelling and inflammation around the disc and the spinal cord and nerves coming out off that spinal cord, going down the arm into the hands. So his quality of life will be greatly enhanced as a result of keeping mobility in the spine. And chiropractors were the only ones out there making sure that that spine and nervous system is being mobilized and being removed of interference so that the body can perform at its very best. I am not saying that as a chiropractor I can go in and remove that stenosis or erase those arthritic changes. I cannot. But as a chiropractor, I can tell you that regular chiropractic care, once we correct as much as we can the problem that's creating this, regular chiropractic care will prevent it from progressively getting worse. That's the best that can be done with that situation. So spinal stenosis is something that we chiropractors have great success with managing. I am not saying that we're correcting spinal stenosis. Please be clear on that. We can manage it so that your spine can work at its very best with that arthritic change going on in your spine and stopping it from progressing any further. So if you have been told you have spinal stenosis and the only option is drugs or surgical intervention, please don't take that as the only resolution, because that is not a resolution most of the time. That is a disaster. We don't want you to become a drug addict, right? So please consider having your spine and nervous system checked by a chiropractor. If you live local, I want to be your chiropractor. I do. I want to be your family's chiropractor. I want to be given the opportunity to help you or your family member or your friends express their fullest health potential, regardless of that label of spinal stenosis. Again, I can't erase it. I can't take it away. But I can manage it so that your body can be at its very best. And that's what chiropractic can do for people suffering with spinal stenosis. If you know you got it, please make an appointment. If you know somebody who's got it, please tell them to make an appointment. I'd love to be your family chiropractor. So this is Dr. Anita. You've been riding in the car with the chiro. I just want to say, have a wonderful 4th of July weekend. Please be safe, and God bless the United States of America. God bless America. You have a fantastic week, and I'll see you on the next ride. Signing off.